We've seen the increased use by EMS and by some of our first responders utilizing naloxone, and there's more availability of naloxone. So we're saving more lives, and I think maybe, I guess you could say, one of the greatest successes is the awareness that people now are looking at this and saying, oh wow, let's get the naloxone out to the sheriff's department. You know, all of EMS has had it, they're using it. So we've expanded naloxone use. We've made people aware that the pill and heroin and opioid problem is real, and we're addressing it in our community.
Invariably, when we bring up the issue of distributing naloxone, there'll be someone in the audience who says, well, doesn't that encourage more risky behavior? And we have the data to show that that's not the case. San Francisco has been distributing naloxone to heroin users for many years, and mortality decreased significantly. And then they started co-prescribing naloxone to patients who are on chronic opiates, and they showed a 63% reduction in ED visits. So I think the numbers prove that naloxone distribution is effective in keeping people safe.
The distribution of Narcan, you can actually prevent overdoses. I mean, think about the HIV epidemic. We didn't have, except for condoms and needle exchange, we didn't have really a drug that would, boom, stop the spread of HIV. And yet we have a drug that's available by nasal inhalation and or by use intravenously, really in multiple ways you can distribute it.
A year ago, when we talked about having people carry naloxone or distributing naloxone, we had a huge amount of resistance from basically everybody. They thought that it should just be EMS or the ER that handles that. And a year later, we've got several departments who are chomping at the bit to distribute it to people they know who use or families they know who have users. So I think it's just been having the conversation over and over and slowly getting people on board that has been successful.
Clearly, naloxone is a valuable tool. And law enforcement in many areas appreciates it and has engaged the use of naloxone on a first response basis. Other agencies have understandably declined in deference to the fact that in their particular situation, in their locale, the first aid responder tends to get there before the sheriff deputy or the police officer. Therefore, it makes much more sense to concentrate the provisioning of this drug to those people.